Hello everyone and welcome back to a new video. So here we will talk about the Neuroleptic Malignant Syndrome. This is one of the adverse effects of the antipsychotic drugs, and here we will explain all the details related to this syndrome. So we will talk about the definition, signs and symptoms, pathophysiology, diagnosis, treatment, and complications of this syndrome. You can always skip to other parts of this video using the video chapters available in the video description. So let's start by breaking down the meaning of each word in the name of this syndrome. So neuroleptic means it is caused by an antipsychotic drugs, because neuroleptic is the other name for the antipsychotic drugs. So it happens mainly as an adverse effect to the typical and atypical antipsychotic drugs. So it happens as an adverse effect to all the antipsychotic drugs. But it also occurs after sudden discontinuation of the anti-Parkinsonian drugs. Malignant means that it's a serious condition, so it's a life-threatening condition with mortality rate of 20%, and syndrome means that it's a set of symptoms. And this picture shows the most common drug that causes the syndrome, which is the haloperidol. So we mentioned that it's a syndrome, so it's a set of symptoms. So what are exactly those symptoms? So the patient develops neuroleptic malignant syndrome within hours to days after exposure to the causative medication. And it initially presents as muscle rigidity. And then the fever develops because sweating is impaired in these patients due to the anticholinergic effects of the antipsychotics. And stress leukocytosis start. So there would be leukocytosis in the lab investigations, but that is due to the stress exerted into the patient body. And the stress, leukocytosis and fever may mislead you into thinking that it is an infectious process, but it is not. And then the patient would develop altered mental status. They would be confused, stuporous, and even they might be comatose. And the patient would have autonomic instability in form of altered blood pressure and heart rate is present. So they always say that the neuroleptic malignant syndrome is a triad of hyperthermia, meaning fever, and muscle rigidity, and autonomic instability. And by autonomic instability means that the patient's blood pressure is changing and the heart rate is changing too. And the muscle creatinine kinase is elevated, reflecting muscle damage. And the patient would have tachypnea, tachycardia, siluria, meaning excessive salivation, flushing, skin pallor, and incontinence may be present. And the patient might have other extrapyramidal motor findings other than the rigidity that might be present. Examples: the tremor, the chorea, the akinesia, and dystonia. And the patient might have other symptoms like dysphagia, dyspnea, abnormal reflexes, mutism, and seizures. Now you might ask, what is the reason behind these symptoms of the neuroleptic malignant syndrome? So what is the exact pathophysiology of that? Now this syndrome occurs due to excessive blocking of dopamine receptors in the nigrostriatal pathway by the antipsychotic medications administered to the patient. So when there is excessive dopamine blocking in the nigrostriatal pathway, this would lead to severe form of extrapyramidal symptoms. So we know that with the antipsychotics, they would lead to some extrapyramidal symptoms like dystonia, akathisia, and tremor. But when there is excessive blocking of dopamine, this would lead to severe form of extrapyramidal symptoms in form of neuroleptic malignant syndrome. So there is another pathophysiology to this syndrome, which is related to the anti-Parkinsonian drugs. So the anti-Parkinsonian drugs are dopamine and dopamine agonists. And with the use of these medications, there would be dopamine receptor upregulation in the central nervous system. But if we suddenly discontinue these drugs, the antiparkinsonian drugs, this would lead to severe dopamine deficiency in the central nervous system and specifically in the nigrostriatal pathway, same that happened with the antipsychotic medications, thus leading to the severe extrapyramidal symptoms in form of neuroleptic malignant syndrome. So this would lead to the same symptoms in form of muscle rigidity, hyperthermia, and autonomic disturbance. Now, what is the risk factors for this syndrome? So the main risk factors include the use of high potency antipsychotics, especially the typical antipsychotics, and the rapid increase in the dose of the antipsychotic medications, and the use of the long-acting forms of antipsychotics, for example, the intramuscular depots, and the concomitant use of lithium. Now let's talk about the diagnosis of the neuroleptic malignant syndrome. So it is diagnosed according to the DSM-IV criteria, and in this criteria, the DSM-IV criteria for NMS, there should be 4 criteria that has to be present in the patient for us to diagnose NMS. So criteria A is development of severe muscle rigidity and elevated temperature associated with the use of an antipsychotic medication. So there should be severe muscle rigidity and elevated temperature. Criteria B is that 2 or more of these symptoms has to be present in the patient. Number 1, diaphoresis, dysphagia, tremor, incontinence, altered mental status from confusion to coma, mutism, tachycardia, change in blood pressure, leukocytosis, and elevated creatinine phosphokinase in lab testing. So any of these 2 will satisfy the criteria B. Criteria C, the symptoms in the criteria A and B are not due to another medication or any other neurological or medical condition. And criteria D is that the symptoms in criteria A and B are not better explained by any mental disorder. So there is a gap in this criteria, and that is it did not include the antiparkinsonian drugs. So if we include the antiparkinsonian drugs in criteria A, this criteria would be complete. And again, for us to diagnose the neuroleptic malignant syndrome, all the 4 criteria mentioned has to be satisfied. Now let's talk about the differential diagnosis of the neuroleptic malignant syndrome. So we think of stroke, CNS infections, encephalitis, delirium, status epilepticus, and heat strokes. Now let's talk about the treatment of neuroleptic malignant syndrome. So it's a neurologic emergency. It has to be treated quickly, and the most important treatment is stopping the antipsychotic medication, or if it happens when withdrawing an antiparkinsonian medication, then put the patient on that medication again quickly. So if it is an antipsychotic medication, we stop it. If it is an antiparkinsonian medication that is withdrawn, then we return it to the patient. And we use aggressive hydration to prevent renal failure due to rhabdomyolysis. So because of the rhabdomyolysis, we have to use aggressive hydration to prevent the patient from developing renal failure. So diazepam is used as a muscle relaxant, and metabolic abnormalities should be corrected, and cooling of the patient body to relieve fever, and the patient might require hemodialysis to solve the renal failure occurred from the rhabdomyolysis, and switching to atypical antipsychotic drug is indicated after the syndrome resolved. Finally, let's talk about the complications of this syndrome. So the first complication is renal failure, which is secondary to the rhabdomyolysis. This syndrome also might lead to disseminated intravascular coagulation, secondary to the rhabdomyolysis also, and venous thromboembolism is a possible complication from the dehydration and immobilization of the patient, and aspiration pneumonia because of the altered mental status and difficulty swallowing. There might be also cardiopulmonary failure, seizures, arrhythmias, myocardial infarction, and sepsis. And with that, we reach the end of this video. Thank you guys for watching. Please make sure to like this video and subscribe. And if you want to support more, you can by subscribing to the Patreon, link provided in the description of this video. Thank you for watching, and peace.